This is brought to you by the Spring Cooperative, and it's an employer update webinar. Just trying to get my slides straightened out here. Okay, this is what we're going to talk about today, the health insurance landscape entering 2014, and even though we're into 2014, what's coming up this year, and then looking forward to 15 and beyond. Some of the new ACA fees that are in place for 2014, some potential employer penalties in 2015, Section 125 changes, and that affects a lot of businesses. We've had a lot of comments and calls regarding this, and we'll go through some of that. The flexible spending account, FSA changes, employer medical assistant contribution changes. Then we'll get into something that we've been working with very diligently over the last couple of years, and that is, what is the Spring Cooperative? What are the member benefits around the Spring Cooperative? Some additional products available to members of the cooperative, who's involved, what organizations are participating, and how can I get more information on that? And then we'll get into a section on questions, but I open them up questions for anybody during this presentation. If you have any questions, you can just submit it electronically, and I will be glad to address it if I can, and if I can't, I will note it, and then we'll get back to you. So the health insurance landscape entering 2014. So what the Affordable Care Act, the ACA has changed over the past few months, and this is just a list. The Federal Health Insurance Exchange opened in 10/1/2013, and you must be very well aware of the issues that have gone along with the opening of that. Many states have struggled mightily, including Massachusetts. The federal exchange was fraught with issues. So as we get into the first couple months of 2014, and the deadlines around the enrollment in the exchange is taking place, the fact that there is so many issues still with these exchanges has created an awful lot of problems. And you'll see there's been articles written, and there's been pieces done on the number of challenges around that. That mostly affects individuals. The individuals are perfectly suited and best suited to work with to go through the exchange to get their insurance. Those who are eligible for employee-sponsored health insurance haven't had a real reason to go onto the exchange. Not to say they can't, but very few have had the reason to go onto the exchange. And that, coupled with the myriad of problems, make it look like it's really not going to be a viable alternative going anytime in the near future or going forward, until some of these issues are addressed. And even after that, there's still questions of whether or not the exchanges really offer anything more than what is already happening in the marketplace. So health insurance exchange coverage began 1/1/14. Many entities, many individuals that were eligible for subsidies through the state and the federal government had a real problem getting into their plans for 1/1/14. There was a lot of delays put on that through the end of March. Categories of people that were eligible previously for subsidized care were actually just auto-enrolled into new policies, which was not going to be the case because of the many problems that occurred all over the country. So you'll see much more on that as we get closer to 3/31/2014 about what opportunities will be available and the process that people are going to be using to get into these exchanges as individuals. Health insurance tax on all fully insured health plans became effective on 1/1/14, and a number of small group insured market reforms went into place in 1/1/14. Individual health coverage mandate took effect on 1/1/14. Medicaid expanded 1/1/14, and then the wellness program changes were implemented at the beginning of this year as well. So this is the big year for health insurance reform, is 2014. There were some incremental changes that took place in 2011, 12, 13, but 2014 was when many of the components, the big one, which has been discussed nationally, is the 10 essential health benefits. And one of the things we've been seeing as being brokers in the marketplace on the front end on this, on the front lines, is that we have seen some initial renewals during the open enrollment period for really small businesses for the first and second quarter of 2014. We've seen the rates be exceptionally high, and the reason why is because to implement the myriad of adjustments and mandates for the healthcare reform law and the 10 essential health benefits, a lot of the plans that people were used to having had to incorporate all these changes, and those changes were very expensive. And that, with a lot of the rating rule changes, meaning the way the businesses were rated, it changed a lot of the factors that occurred in the past, and in doing so, it is raising the cost of premiums across the board. One of the things that's kind of lost in all this is to ensure upwards of 33 million people that were previously uninsured. There had to be taxes and fees incorporated into everyone's plans to help pay for these people, even though many of them have had trouble getting into the system with many of the glitches we've seen around the country. There still has to be a way to pay for this, and a lot of it is incorporated around the taxes and fees, and then adhering to the 10 essential health benefits and beyond. Things like no pre-existing condition clauses, and which is great. And what they call an annual physical, free annual physical, but they're not free. They're actually, you're paying for those in your fee, in your premiums. But all these different components were factored in that went into effect on 1/1/14, and as a result, we're going to see higher premiums pretty much across the board. So these are some of the fees we were just talking about. The Patient-Centered Outcomes Research Institute fee, which is PCORI, the fee included in health insurance premiums through 10 of 2019. It's $1 per member per month in year one, and you don't get that as a separate fee. It's buried into the premiums that you'll be paying upon renewal in 2014. So if your plan renews in April, you'll see it upon April 1. If your plan renews in December, you won't see that fee go into effect until December. Whenever your plan renews, sometime within 2014, this fee would be applied. That and the health insurance industry tax. It's a permanent fee included in all health insurance premiums. It's 2.5% increase in year one, and it's increased to 3 to 4% entitled to inflation thereafter. So this is another fee that's been put in there as well. The third is the transitional reinsurance fee. It's a temporary fee included in health insurance premiums through 2016, $63 per member per year, and it's split up over the entire year. So there's actually 2 times that it's applied. It's applied in the front part of the year. When plan is renewing, it's applied in the front part of the year, and then the back end, there is another fee applied. So it's set up to around $53 or $52 at the front end of it, and then $11 near the end. So the carriers have to account for this to incorporate these fees into the premiums, and these are just some of the reasons why you're seeing what we're seeing so far through the first 6 weeks of 2014, higher than expected premiums. Because if you really take a step back and look at this, the premise of healthcare reform was to get people accountable for their insurance and people accountable to where they get their care and things like that, as well as covering the 33 million people that were uninsured, and then making a baseline of coverage for people around the country, reducing things like pre-existing conditions and cherry picking and things like that. But that was the goal of this. But all through it, we were hearing comments made by the federal government that this would reduce premiums. It hasn't been the case, because when you're adding all these new benefits, reducing or eliminating previous conditions that kept some of the costs down somewhat, and then having to cover millions of people that were not previously covered, the money has to come from somewhere, and that's unfortunately what you're seeing. And so the only way to do that is to pass the costs along to the members. When those costs are passed along, your premiums go up, and that's what we're seeing thus far. These are just some penalties that we're seeing for 2015 and 16. I'm on slide 5. Potential employer penalty, 115, 100 plus employees, and then 1116 for 50 plus employees. It's considered unaffordable coverage if the cost of coverage for an employee is greater than 9.5% of his or her annual gross income, and one per employee receives subsidized coverage through the Mass Health Connector or through a connector. The penalty is $2,000 per employee over 30 employees. So keep this in mind for business owners. We call this the 9.5% test, and basically it works like this. If you've got, they take the lowest cost insurance plan offered to your staff or to your employees, and you take the lowest one. So if you offer 3 plans, for instance, and one is 600, one's 500, one's 400, you take the lowest cost plan, and you take the contribution made by the business out of the equation. So let's say it's a $400 plan, and the business contributes 50%, and the business contributes 50%, and the employees contribute 50%. You take the individual amount, which is so $400 divided by 50%, which would be $200, and you divide that number. You annualize that number, so it'd be $2,400 divided by the annual gross income of that employee. So it's just a factor used. So you take the contribution amount annualized, and you divide that by the annual gross income. And if it's more than 9.5%, it is considered to be unaffordable. And so there's a couple things you should be looking at, and certainly working with brokers and consultants can help you with this, but you would want to do this analysis for every single employee that utilizes insurance in your office. So, and by the way, keep this in mind, if you have an individual and a family member, you only factor it based on the individual premium. So that can change some of the equation, because some people say, I can't afford this family plan, it's very expensive. This analysis is really focusing on the individual premium of the lowest cost offering made by the office, or made by the business. So that 9.5 allows you to proactively look and say, should I be increasing the salary of this employee? That's one alternative. Should I be covering a higher percentage of the insurance for this employee? Is this employee potentially eligible for subsidies through the healthcare reform law? And that's something that you can work with the employee and through your consultant broker, to help you through that, to see if it is something that employee could utilize subsidized care and save themselves some money. So these are analysis that needs to be done, and needs to be done frequently. And it's nothing more than just running the analysis and then deciding what steps you're going to take. The employer can also say, I'm not going to take any steps. I'm not going to do this, and I'm going to pay the fee. And that's where the middle part of the slide talks about a $2,000 per employee fee. I always get concerned that employers may think of just abandoning the coverage altogether. So if an employer provides no coverage, there is a penalty as well. But keep this in mind. While employee benefits are very expensive, they're also very important to the employees that your business employs. And we know that, like for instance, health insurance is usually the second most expensive employee benefit after salaries. And so you do have to gauge and weigh what you want to invest in terms of benefits versus what your budgets and your strategic plan is for your business. But we want to look at this also as a retention and a recruitment tool. So if you were to walk away from offering insurance at all, you get a penalty. Plus, are you going to be competitive in the marketplace against employers that would be offering some kind of a subsidized employee benefit package for the employee? It could put you at a competitive disadvantage, and that's something you need to consider as part of this, along with the penalties that you'll be levied as well. So keep some of these factors in mind, but you need to really get a sense of what the structure is of your business and how you want to go forward based on a 9.5 analysis, and again, what your financial situation is of the company. Section 125 changes. This has been an item that's been looked at very carefully over the years. As you know, with Section 125 plans, they are the premium offset. The premium offset allows you to put money away pre-tax for premiums that are paid for by the employee. That's just one part of a Section 125. Then there's the flexible spending accounts, which are monies, again, put away pre-tax by the employee, can be also by the employer, or a combination of both. And that money is put into a pot available to spend for qualified purchases of things like deductibles or dental work or things like that that may or may not be covered by your insurance, although it's not directly tied to insurance. A lot of times it is a nice complementary option for people. For instance, if let's say your dental plan only covers $1,000 of ortho benefits, and you have 2 children have ortho benefits, you can use flexible spending money, pre-tax money that you put away to pay for some of those services. And there's a list of services that are qualified. That there's, they're pretty diverse, and they're very well known in the industry. Most people use it for things like prescription drugs, deductibles, copays, dental work, maybe vision, maybe glasses, things like that. So it's a really nice benefit, and it's, again, another recruitment retention tool. But one of the real negatives of it was that many people had to, with a Section 125 in the past, it was a use it or lose it type of proposition. So that if you didn't use the money within the policy year of the 125, you would lose. The employee or the utilizer would lose the remaining balance if not utilized through the end of the year. So there's been just a variety of changes to that. So benefit, these are just, and there's a couple more to this, but I'll just start with this. Employees cannot use Section 125s to purchase coverage through the Mass Connector or receive subsidies from their employer to pay for this coverage. This is just one of the many 125 and flexible spending accounts. So let's talk about this first one here. So if an employee decides that they are, even though they're eligible for insurance, for instance, through their employer, they wanted to go out and buy individual insurance through an exchange. And we've seen this many times. The employee goes out, they get quotes for an individual policy. So a lot of times we'll get calls and they'll say to us, well, I'm paying, my plan through my office is, I'll just do it for instance, is $400 a month. But I can go and find a plan through the exchange that may be $250. Let's just say, for instance. So how that would work is, my first question would to be for these people would be, then what are you spending in terms of contribution? What is your final cost? And so typically it's 50% or more, but say 50%. So their actual cost is $200 because they're getting a contribution made by the employer. In addition to that, if they have a Section 125 plan attached, they can take that $200 that they have to pay on a monthly basis, and the monies can be contributed pre-tax. So instead of it being a $200 expense to the employee, the net effect would be bigger 30% effect. It would be about $140. So that insurance plan that they're getting through their employer, just say for instance, is $140 a month. That's what the net effect is. Yet if they go onto the exchange, the gross amount is less, $400 to $250, and I'm comparing apples to apples as much as possible, just for an example situation. But what they can't do is they're not getting a contribution from their employer. That is forbidden under the rules, and they're not able to take what they pay, the $250, and do it pre-tax. So in other words, the $250 may be cheaper on a gross effect, but on a net effect, it's a much better deal for the employee to buy insurance get insurance through their employer because of the Section 125 effect and for the contribution made by the employer. So this is something that you hear a lot of times people say, and it's certainly a misnomer. Well, I'm going to get cheaper insurance if I go and get insurance through the connector or through the exchange. If you're really comparing apples to apples, Many times it's not less expensive unless there is a person that is eligible for some kind of a subsidy. So we'll go to the second part of this, non-benefit eligible employees, so part-time and temporary. So you have an employee that is not eligible for employee benefits because they fall under the number of hours, whether they're temporary or part-time or whatever. Section 125 funds can be used through the end of the policy year commencing in 2013. However, upon renewal in 2014, these funds cannot be used to pay for health connector coverage. So what's basically happened is in the past, Section 125 was able to be used by coordinating those services through their employer. So using the employer's 125 plan, the employee who's not eligible for the benefits through the office could actually funnel their premiums as a payroll deducted pre-tax and get the effect of that. But that opportunity is going away upon renewal in 2014. So if you've got an individual who's not eligible for benefits through their employer and they buy insurance through the exchange as an individual non-subsidized, they would not be allowed upon renewal to utilize a Section 125. So that makes it less attractive, unfortunately, to that individual who may or may not be eligible for a subsidy through the federal government or through the state. So this is not a favorable development for many individuals who are not subsidy eligible. This puts them in a very difficult situation. And there are strategies that can be used to help mitigate some of that by working with good broker consultants in the industry. So I talked a little bit about the flexible spending account changes. So 2 years ago, they put a cap on the amount that a flexible spending account can be funded up to $2,500. And then, as I mentioned earlier, that one of the nice things about flexible spending accounts was giving you the flexibility to use some of these pre-tax monies for a variety of qualified services. But the negative was that you could not roll any of that money over. So if you didn't use up, say you allocated $1,000, and you didn't use that whole $1,000 during that policy year or plan year, you would forfeit any unused monies. Now, there was an amendment made in early November of 2013, and it would go into effect really 11/2013 and beyond, that employees, along as the employer had restructured the plan, can now roll over upwards of $500 of their unused funds to the following plan year. So it doesn't, in essence, it does not impact the $2,500 plan year limit that has been put in place. And by the way, this was done when they put the cap on the flexible spending account. This was in essence a tax on people who had previously done it. So if you had used a flexible spending account in the past and you put $3,000, $4,000, $5,000 a year away, they're capping it at $2,500 because therefore anybody who, let's say, had put $4,500 in the past, they were losing the tax advantage of $2,000, which on a 30% average tax bracket, that would result in a $600 loss of tax revenue to the individual, but that $600 would now go to the federal government. So there was in essence a tax on it. This mitigates that a little bit, gives a little bit of flexibility that people can maybe account a little bit more aggressively for how much money they want to put away, knowing that they have a little bit of flexibility if they don't use all of it, that up to $500 can be rolled over. So that's a good development. I wasn't all that thrilled around the $2,500 max. However, having a $500 rollover is a nice addition to the FSA accounts. So we've talked about a lot of things so far, but the employer medical assistance contribution, what they call EMAC changes, these are some additional changes coming. Employers with 5+ employees will be charged $50 and $50.40 per employee through the unemployment system to fund the Massachusetts State Trust for Uninsured Residents. This is something that we're seeing go into effect in early 2014. and going forward. To some, this is a little bit of a benefit because the old charge was upwards of $67, $68. This has been adjusted downward, but it's taken off some of the reporting requirements, which is a benefit because there was a multitude of reporting requirements around what they call the herd and fair share, and that was hopefully to fund some of these programs. This now just is a flat fee. So if you didn't in the past qualify, they brought the threshold down to 5+, and they just made more of a flat type of cost. So it's a benefit in some ways, and it's also an additional tax in many others as well. I'm going to slide 9. This is a new development, and a new development for the Mass High Tech Council and others is around the Spring Cooperative. So what is the Spring Cooperative? I had mentioned previously that premiums are, and nothing has been released yet as of the 12th of February of 2014 for April renewals, and many small businesses in Massachusetts renew in March, April, May timeline, but specifically April, May, June, second quarter rates have not been released, but we've been hearing some stuff that's been released to the market is that the rates are going up substantially. So any opportunity to save some premium dollars is very attractive, and the Spring Cooperative was an organization that was formed back in actually 2011 and was formalized in late 2013 that helps employers fight rising health insurance costs and provide innovative, robust employee benefit packages. And that's the goal. We want to, the goal of all employers is to offer a good benefit package to their employees, but one that is keeping in mind the cost pressures and things like that. So the Spring Cooperative allows small businesses to come together on a joint purchasing initiative. So it's not only health insurance, although it's right at the top of the list. There are other lines of insurance, including life insurance and others, that can be purchased through almost like a buying cooperative kind of approach. So it's open to members of any state-approved, which is Division Insurance approved, Massachusetts-based trade or industry organization, and those organizations targeting employers that have 50 or less employees enrolled in the plan. So it's really focusing on the very small to 50 life businesses. Now the co-op, that was the focus of the co-op was to really help small businesses. But obviously there's strategies that can help businesses that are bigger than 50. But in terms of a buying opportunity, the focus was on employees of 50 or less. So by joining the Spring Cooperative, members will be able to take advantage of a multitude of benefits: reduced health insurance premiums, innovative wellness program, which is really important, and we're seeing more and more opportunities for small businesses to take advantage of wellness, because wellness, in essence, makes employees accountable and subscribers accountable for their own health, and to either to solidify what healthy actions they're doing, or maybe look at altering some of their lifestyle and to make some changes to improve their health. And by doing so, over the long term, it is a cost benefit for the cooperative and all the cooperative members. It's called bending the cost curve. It bends the curve down because as people take more an active role in their health, they will be managing their existing issues better. They'll be getting healthier, which on the long term reduces claims, which ultimately has a major effect on reducing overall cost of premiums. So wellness to small businesses, something that has been out there but hasn't been highly utilized under the Spring Cooperative. It is a mandatory component, and I think it's a very positive component. Long-term premium savings and improved wellness for all participants. As part of it as well, there is a state-of-the-art online portal to manage benefits. This is a really nice tool that allows employers and employees to go in and manage their adds and deletes to their office staff, make alterations, look up benefits. And this is available to employees and employers 24/7. It's an electronic-based system with a distinct login. People can go in and look up all their information on the plans, what they've enrolled in, and other benefits they may not be enrolled in, but would want to look into it in a little bit more detail. And also, a nice thing is, through the Spring Cooperative, you have access, employers, employees have access to licensed, trained, and experienced customer and client support people that have extensive experience around health insurance, employee benefits, HR, basic HR issues, and things like that. And that's a real nice tool to have for businesses, especially small businesses who may or may not have the HR staff at their own firm. This gives them customer service access to how the employee benefits and how they relate back to the business, and certainly through HR. Going to slide 11. These are some of the additional products and services that are available. So we mentioned health insurance, certainly, pet insurance, and life insurance and dental. It's amazing how many employees are pet owners. And we get calls all the time saying, we want to insure my 2 dogs, or my cat and my dog, or my 2 cats. Pet insurance is available on one life or one animal basis, and there's additional discounts for multiple pets in a household. We have dental insurance, which is a very highly utilized and appreciated benefit. Life insurance, identity theft, which you've seen with many instances of, I think the most recent one was Target, where there was some problems around the data getting out to the general public through people, breaking through their security ranks and exposing pertinent and personal information out to the marketplace, not in a good way. And so identity theft products and services help protect and mitigate loss around issues such as identity theft and maybe lost and stolen credit cards, break-ins at your house in terms of data that's taken and things like that. So I personally have been on an identity theft program for about 4 years, and it monitors my credit. It works in conjunction with my credit cards and my bank accounts, and all that. It monitors it, protects it, and also gives you a vehicle to use in the event that you are hacked in some way, shape, or form, whether part of a bigger issue such as Target or just a personal item where you lose your wallet or it's stolen or something like that. It's invaluable for a very little bit of money, and the beauty of the program that we incorporate in this is it's an identity theft bundle that offers LifeLock, which is an excellent identity theft program, along with a prepaid legal program and financial services consultation service, all at a price that's less than if you were to just get an identity theft program in the marketplace. And that's the goal of all these programs. We're trying to offer unique purchasing opportunities for members of the cooperative. Short and long-term disability, and then I mentioned some of the changes in Section 125, HRA, and HSA. Those services, those are administrative services that we provide. In addition, we can provide COBRA benefits and administration. And then I think I glossed over, but travel insurance. It's amazing the amount of people that travel, certainly going overseas, going to exotic islands and things like that. This gives you there's travel insurance programs. There is what they call, if we have a MedJet type of program that allows you to get medevaced in the event of a serious issue back to the hospital of your choice from anywhere in the country and anywhere in the world. So these programs are all available. You don't want to get overinsured, I understand that, and but it's nice to know you have these services available in the event that you need them. And that's why we set up the program like this and availed all the members of the cooperative to enjoy these benefits. So who's involved? These are just some of our partners, just a small sampling in the health insurance space: Harvard Pilgrim Healthcare and Fallon Community. Actually, now it's Fallon Community Health Plan has now been changed to Fallon Healthcare, and that's new in the last week. Minnesota Life is another one of our partners, and we have a significant amount of other partners that are not listed here, but this is just a sampling of it. So what organizations are participating? We have the Massachusetts Dental Society, the Massachusetts Society of Optometrists, the Massachusetts High Tech Council, and then we've added another organization that is actually, we're in the final stages of implementation. And then we have talked to a few other agencies who are interested, associations that are interested to joining, and we expect many more to come over the next months and years. So how do you get more information? You can call our toll-free 800 line, 800-821-6033, to get more information and talk to one of our licensed co-op representatives who can go through some of the products and services there. Or you can send an email inquiry, questions at springcooperative.com, and again, that would come into our client service staff and go through some of the questions you may have around products and services. And our hours of operation for the Spring Cooperative is 8 a.m. to 8 p.m. It's Eastern Standard Time, and we or as I said, you can send in an email request or send it to us and we'll get back to you if it's after hours the next business day. So I will please avail myself of any questions. I want to make sure we're very cognizant of the time, but I'll open this section up for any questions. Okay, I have one. And basically it is, when can I take part in the Spring Cooperative? We open the Spring Cooperative up to businesses at any time, and especially this time of year for smaller businesses with renewals coming up in April, March, April, May timeline. We can help you basically at any point within the co-op year. So for us at the co-op, your request or your inquiry can happen at any time during the year, but I certainly would like to promote the fact that if you're going to look at options and it's right around renewal, certainly work with the co-op to give another set of rates, another set of options, and to look at exactly how your employee benefit program is structured to make sure that you're optimizing the benefits and the cost of those benefits. Benefits are expensive. Benefits are confusing. There's so much. We talked about some of the changes that are coming, have already taken place and will continue to take place around healthcare reform. How does that all play together with your overall employee benefit program? I think the cooperative can be a nice component of that, but also how does it all fit in with your employees and what your strategic plan is, what you're planning to offer, what you can afford to offer. What is your long-term hiring strategy and expansion strategy? Do you have employees that maybe live out of the service area, out of Massachusetts or out of New England? And how do you work with that? How do you handle an employee that may be a low-income employee, but a vital employee that may be eligible for subsidies? All this has to be kind of coordinated, and you have to get the right support and the right counsel on how this all plays together. So the co-op is just one component of that. I think looking at the entire benefit program and doing it regularly and understanding what your pros and cons are, and maybe you don't take on all these challenges in year one. Maybe you take it on a portion in year one and look to make some adjustments in the following years. But a highly engaged entity along with a well-trained and educated broker consultant is vital in this new employee benefits paradigm. So I highly recommend you do that, but you can come in and utilize the benefits of the co-op at pretty much at any time. Okay, we've been working together here for about 45 minutes. I think we covered a lot of topics. If you have any other questions, my contact information was included. Send an email to us at the co-op. Call our offices. I'm very happy to answer, and my staff would be happy to answer any questions you may have. I wish you the best of luck. Stay warm during this snowy season, and we look forward to working with you.